Hello and welcome to our discussion on the different divisions of the gut, the primitive divisions, and we'll discuss which organs are in each. We'll discuss their innervations and blood supply as whether or not they are intraperitoneal or secondarily retroperitoneal. We'll also discuss the primarily retroperitoneal structures that are used in comparison with them as they are all located in the abdomen. So first off, we have three primitive gut divisions: foregut, midgut, and hindgut. You see the foregut in green, the midgut in pink, and the hindgut in blue. If you're colorblind, you can just see the numeric divisions of each. The foregut structures include structures like the abdominal esophagus, as the food moves then into the stomach. Spleen is a digestive organ because it digests blood cells. And then we move over to the duodenum, where we mix with chemicals created by the liver, gallbladder, and the pancreas. So let's talk about the preganglionic parasympathetic pathway that drives digestion. The preganglionic parasympathetics, the stimulation of the digestion, happens at the dorsal motor nucleus of cranial nerve 10. This gives rise to the left and right cranial nerve 10 vagus nerves. The left will make an anterior turn to become the anterior vagal trunk, and the right will make a posterior turn to become the posterior vagal trunk in relationship to the distal esophagus. Will then give rise to axons as we pass through that esophageal hiatus of the diaphragm, which will become the celiac plexus. This celiac plexus will head to the organ wall, where we'll find intramural ganglia upon which we will synapse. Remember, this can be called the pre and post sympathetic or pre and post synaptic pathway, or it can also be called the ganglionic pathway because all autonomics synapse on a ganglion. They're the only thing that synapse on ganglia is autonomics. As we synapse on the intramural ganglia, we then travel via short axons within our organ wall to the target. To stop digestion, we use the sympathetic pathway. This sympathetic pathway starts at a nucleus, like all autonomics do. This nucleus are called lateral horn cells, and they're from T5 to T9 for the foregut. They then travel on ventral rootlets, a ventral root, a spinal nerve, a ventral ramus, a white ramus communicans, and then the sympathetic chain, where they do not synapse. They will leave via the greater splanchnic nerves, which are preganglionic sympathetics. They'll then travel through the thoracic diaphragm to get to their ganglion, called the celiac ganglion. They'll synapse here, and then the axons travel in the celiac plexus. This was the same celiac plexus that had our preganglionic parasympathetics. So all plexuses that are mesenteric have pre, para, and post-sympathetic. We go to the organs, and as we have here a nice little cheat sheet, there are secondarily retroperitoneal structures, two of which are in each part of the gut. The rest of the gut structures that deal with digestion are associated with intraperitoneal findings. So every structure not circled in this chart, as far as organs, is going to be intraperitoneal. So the abdominal esophagus and the majority of the pancreas are secondarily retroperitoneal. This basically means they did not maintain all of their mesenteries. They only retained it on one side. Whereas the stomach, spleen, liver, gallbladder, tail of the pancreas, and the proximal half of the duodenum all maintained their mesenteries and are deemed intraperitoneal. This provides them with a sling that encourages movement but also keeps them anchored. The artery that supplies the foregut is the celiac artery, the same name as the plexus and the ganglion. So it's easy to remember. Now let's go over to midgut. Midgut, these structures are a little bit different. These structures are going to include things like the duodenum, most of the small intestine, right? The ascending colon, the cecum. So let's talk about their innervation first. The preganglionic parasympathetic pathway is the dorsal motor nucleus of 10, but now it's only the right vagus nerve, which will give rise to the posterior vagal trunk. It will go through the thoracic diaphragm at T10, the esophageal hiatus, and become a superior mesenteric plexus. We'll head over to intramural ganglia within the organ wall and use axons that are unnamed to get to our target space. To stop digestion, we have to travel from a nucleus. So let's travel from the T10 and 11 lateral horn cells for our preganglionic sympathetics. We then again travel on ventral rootlets, ventral root, spinal nerve, ventral ramus, white ramus communicans, and the sympathetic chain without synapsing. This pathway won't change. We then use the lesser splanchnics to head over to our ganglion. Our postsynaptic ganglion is called the superior mesenteric ganglion. Remember, the O in ganglion is for post. Pre comes from a nucleus. We then travel via the same superior mesenteric plexus that carried our preganglionic parasympathetics, but now these are postganglionic sympathetics. Remember, all mesenteric plexuses are pre, para, and post-sympathetic. Our organs that are included in midgut are all of these. Note the circled ones are the ones that are secondarily retroperitoneal, meaning they only maintain one part of their mesentery. The distal half of the duodenum and the ascending colon are your secondarily retroperitoneal midgut structures, whereas the jejunum, the ileum, the cecum, the vermiform appendix, and the proximal 3/4 of the transverse colon are all intraperitoneal. Remember, in gut, you are either intraperitoneal or you are secondarily retro. This superior mesenteric artery is our supply. The same name as the plexus, same name as the ganglion. Easy to remember. For our hindgut is going to include that distal part of the transverse colon, descending colon, sigmoid colon, and rectum. The hindgut is not innervated by vagus. I always remember this as you go to Vegas, you eat the buffet, but you don't clean up after yourself. So vagus doesn't deal with that distal part that doesn't digest much. Instead, it's from the S2 to S4 lateral horn cells. S2 to S4 can put the poo on the floor, is how we remember it. So instead of vagus, we actually use pelvic splanchnics. And look at the P in pelvic for parasympathetic. It's the only splanchnic that we have that's not sympathetic. Typically, splanchnics are sympathetic, but not pelvic. Pelvic are para, a gift from the anatomy gods. These S2 to S4 axons via the pelvic splanchnics will then synapse on intramural ganglia. And then they'll travel on unnamed branches within their target wall. To stop the digestion of the hindgut, so to basically stop the bowels from moving, we'll use the L1 lateral horn cells because we have to start our preganglionic sympathetic pathway on a nucleus. We then take that same pathway we discussed, ventral rootlets, ventral root, spinal nerve, ventral ramus, white ramus communicans, and then to the sympathetic chain where we do not synapse. We then we take the lumbar splanchnic nerves over to where we synapse, which is the inferior mesenteric ganglion. We take the inferior mesenteric plexus in order to get to our target organ. And our target organs include the following: the distal quarter of the transverse colon, which is often called the splenic flexure, the descending colon, the sigmoid colon, and then the rectum. The descending colon and the vast majority of the rectum are considered to be secondarily retroperitoneal, but the distal quarter of the transverse colon and sigmoid are intraperitoneal. And then finally, our arterial feed is the same name as our plexus and our ganglion, the inferior mesenteric artery. These ganglia that are sympathetic are called pre-aortic ganglia because they are in front of the aorta on their respective arteries. So we have 2 ganglia for each of these unpaired arteries. Now, if you look back again, remember that each gut had 2 structures that were secondarily retroperitoneal. All the rest were intraperitoneal that are not circled. So when you're trying to remember things that are primarily retroperitoneal, secondarily retroperitoneal, or intraperitoneal, you don't have to memorize a ton of structures. You have to memorize 6, 2 in each gut. Because all guts, these are digestive things, are going to have some type of mesentery. They're either going to have to be intraperitoneal or secondarily retro. Primarily retroperitoneal means you were never digestive. You were not part of the gut, but you sit behind the guts, so you're retroperitoneal. So the 2 that you have that are secondarily retro are encircled for each gut. Remember the 2 that are in each gut. That's all you have to memorize. And then ask yourself, does this deal with digestion? Is it food or feces? If it's food or feces and dealing with that, then you're going to put intraperitoneal or secondarily retro. If you never dealt with feces or food or digestion in general, then you're primarily retroperitoneal. These are structures like the ureters, the sympathetic chains, the inferior vena cava, the abdominal aorta, the kidney, and the adrenal glands. All great examples of things that are primarily retroperitoneal because they never dealt with gut, so they never had a mesentery. So keep it easy for yourself. Memorize 6 structures. You don't have to memorize all of these and these. Remember the ones that are encircled, 2 for each gut, and you'll remember the things that are secondarily retroperitoneal. Hopefully you found this useful, and hopefully you'll check out the other videos on the Dr. Dooley Noted YouTube.